Good afternoon, Senators. Thank you for waiting for all of us today, and especially for some of us. I came up from Long Island, so it's a 4+ hour ride. So when the meeting cuts off at 5 o'clock, you worry that you made the trip. So I appreciate everybody's time today and getting to work with you. My name is Matthew Hetterich. I serve as the administrator of Gurwin Certified Home Health Agency, part of the Gurwin healthcare system based out of Comac, Long Island. In addition to operating both a LTC and a CHA, we serve as a 460-bed nursing and rehab center that provides long-term care, ventilator care, on-site dialysis, medical and social model daycare. We have an assisted living facility that's across the street. We do memory care. We do the entire care continuum, and soon after the independent building is finished, we will be one of the few CCRCs on Long Island and offering diverse care options for people out on the eastern portion of Suffolk County. So I wanted to come and speak today on behalf of not just the home care agency, but on the whole care continuum, and seeing what we're experiencing right now with what is truly a workforce shortage of not enough nurses, not enough aides, not enough therapists, not enough CNAs. It's been very dire straits between COVID, between other employment opportunities out there. So, we're looking forward to working with you in the future on what we can do. There's been a lot of discussion today. Obviously, a lot of the core issues have already been addressed. There are a couple of things that I would like to suggest in terms of efficiencies that are relatively cost neutral. So, for example, home health aides are required to maintain a certain number of in-service hours every year. They have to do at least 12 hours. The agency is responsible for monitoring those in-service hours. So if an aide works for Matt's Home Care and then also works for Senator May Home Care, she's required to take those same in-service hours for both agencies. There should be some sort of efficiency created within the health commerce system or somewhere along the way where those hours can be recorded on an agency basis and then prorated, which will also allow for those caregivers to spend more time in the field versus time in the office, maintaining those sorts of criteria that are required. In addition to that, there are training programs that are certified by the Department of Health. There are training programs that are certified by the Department of Education. There should be some look into creating either a universal worker program, or how can we allow these trained caregivers to work across different settings, whether it's a CNA in the nursing home, a home health aide that's in the home, a resident care assistant that's at the assisted living, a direct support professional, whatever it may be called. There may be some opportunities in looking at aligning these caregivers and the training and the experience they have in order to be able to service multiple populations, not just for one provider like Gurwin, but for multiple providers out there, and to allow them different opportunities there. In addition to that, one thing I did want to mention that has been a positive also is Gurwin had created a position called the resident care assistant, which was an extra set of hands that we utilized in the nursing home in COVID. This was untrained staff that would be able to at least triage call bells, help with food deliveries, things of that nature, non-clinical hands-on or non-clinical tasks to allow our other caregivers to provide that care. We'd be hopeful in looking at the staffing ratios that something like that would be allowed to be included in that hourly fix or that hourly range of care that's going to be required come January. There's been a lot of horror stories today, but one of the things that I did want to mention is, Gurwin is a CMS-rated 5-star facility. We spare no expense when it comes to employee benefits. We offer wages that are above and beyond any of our competitors that are out there. In addition to that, we already meet all of the staffing requirements that are going to be required of us. We are a quality provider that believes in putting the patient at the center of our care, and then everything else will fall into place. When we get calls from for-profit providers that are inquiring as to what we're doing differently and how we're operating in this environment, that's somebody that should be included at your table in terms of these discussions and moving forward. So with that, all I wanted to say is before the pandemic, people had already preferred to age and receive care in place in familiar surroundings whenever possible. This has only grown truer in the post-pandemic world as many people look to bypass facility-based care completely, and new federal programs such as SNF at Home, Hospital at Home continue to showcase the ability of home and community-based services to deliver higher levels of care in a safe and efficient manner. With the lessons we've learned regarding infection control and the capacity of the overall healthcare system, an investment into home and community-based services is money well spent, as it's been repeatedly demonstrated to be a cost-effective patient care solution at a variety of levels that's not limited by walls or the number of beds. So, thank you.
Thank you.